The idea about coaches. Yes, it's an investment. No, it's not covered by insurance. You know, what's covered by insurance is usually a trip to be diagnosed as a diabetic or pre-diabetic. The medicines that are usually prescribed for pre-diabetes or diabetes, depending on your copay. Then eventually the specialist that you have to see if you're not able to control your sugars. And then eventually the stent that you have to put in because the specialist didn't control or was not able to help you control your sugars or decrease your risk factors. So that's all covered by insurance if you're thinking about that. But the downside is that even though you save money and you just go with what's covered by insurance, your lifestyle sucks. And then not only does your lifestyle suck, you wind up becoming disabled. Not disabled like you're missing a leg. We don't hardly see anybody with below the knee amputations anymore. I think we're getting to the point where we're not seeing too many diabetics go into dialysis, but you'll have so many different medicines to control your kidneys, to control your sugars, to control your blood pressure, to control your cholesterols, to control your emotion, that you'll have side effect upon side effect when most people haven't done the basics of working on relaxation, exercise, or nutrition. Now, so that's why it's important to consider coaches. You can hire somebody outside the paradigm of what's covered by insurance. You might have a better chance at controlling what's out of control. And it's not just sugar, it's lifestyle. I mean, granted, we try to follow sugar because that's one of the easiest metrics for doctors to follow in that 15-minute window. We'll see what your blood pressure is doing. We'll see what your sugar is doing. We'll check out that thing called hemoglobin A1C. And then we'll look at your cholesterol levels. And then if everything is falling within the parameters, give you refills on all medicines, see you in 3 to 4 months until we see that you fall off the wagon. And then usually at that point in time, up the dose of your medicines or give you another medicine on top of it. It really, as I mentioned in the last video, doctors have limited time to empower. You usually just check metrics, make sure that you're still alive, make sure that you're not having any symptoms that you might not recognize as worsening disease, and then have you either seen by specialist or the other folks that are covered by insurance, physical therapy, registered dietitian once a year, or specialist. And then we have you come back again. That's the best way to handle the disease, because in Western medicine we really have more of a model of disease management. We really don't have preventive medicine. I think preventive medicine, as I pointed out in the lecture, is prescribing exercise, prescribing a relaxation practice, a stress busting practice, empowering with nutritional changes that are sustainable. There was a gentleman yesterday who said that he had his pancreas taken out, spleen taken out, something else. I'm assuming he had some form of either a Whipple procedure, that's usually for pancreatic cancer, or some kind of cancer, I'm assuming. So with that, because there's no pancreas, which is the organ for controlling insulin, glucagon, other enzymes for digestion, he has to rely on medicines to do all that. And he has to be his pancreas. Sounds weird, but just like having ancillary help or ancillary health providers do the job of the doctor, it's really important to be able to be the pancreas. It just takes a lot of knowledge. And if you have no knowledge and you're just taking enzymes or shooting with insulin, occasionally rescuing with glucagon or sugar, then again, you're reacting to the uncontrolled state of diabetes. You're reacting to the change. You're not ahead of the problem. So I think even with that gentleman and the majority of folks that were coming in to see me, even if you have oral medicines for diabetes and insulin for diabetes, I think it's still tangible to improve the disease process. Whether that guy has pancreas or not, whether your pancreas is making insulin, or whether your cells in the body are responding to insulin and sugar together, even if they're not right now, I think it's still important. I think it's still possible if you gently tease out and bathe each cell in your body with proper nutrition, really good rest, and bursts of activity. Like this. This is not going to a gym. This is me going to the Swallow Cliffs, Stairs, Palos Hills Forest Preserve. All I'm doing is walking. I'm not even walking to the speed where I can't talk that much. That's perceived exertion. I'm just walking because it's cool. I'm unplugged from the internet. I'm slowing down. So hopefully once I turn this video off, I can just enjoy nature and something cool about. So when I work as a hiking guide, I don't take everybody on big summits, but sometimes it's just an easy hike in a local forest preserve just to slow down and enjoy and be witness to what you can get as far as the healing process. This is much better when I finish with my hike now, which I'm prepping. I'm doing this for distance and I'm prepping for my big calendar summit of going to the Appalachian Trail. Every year I try to plan a different activity or summit because it keeps me honest. And that's where I expect my patients to also be honest and accountable. And again, going back to the original concept, sometimes it's a lot easier and more sustainable if you're accountable to somebody else. Not just me with that once a year visit or every 3 month to 4 month visit, but also to somebody else who can throttle what you're doing, change up the activities or the nutrition or your relaxation depending on the season. Sometimes you'll have to quiet down the amount of exercise, increase the amount of stress relief depending on season. Like we have winter coming up with 3-4 different holidays, a lot of feasts. It's going to be hard to continue with the same type of exercise and diet that we rely on in the summer. So if you're not well versed, get somebody else to anticipate that and design the next change for you. That's why coaches are really a great investment.